The impact of artificial intelligence on our daily lives is impossible to ignore. But what about AI's potential to help save lives? Computer science and engineering professor Xia Ning also holds appointments in the College of Medicine and College of Pharmacy. This unique combination catalyzes her focus on developing cutting edge AI methodologies with transformative applications in medicine, bridging the gap between computational innovation and real world healthcare challenges. She has published more than 150 peer reviewed articles in high impact journals and prestigious venues, with notable breakthroughs highlighted in Nature's Special Collection and long lasting impacts recognized by several awards. She is currently a co lead of the AI in Health pillar of the newly established Ohio State AI Hub. Zhao, thanks for joining me on Enginuity.
Thank you for having me.
So, AI is seemingly everywhere right now. But as you know, it wasn't always this way. In fact, my fascination with AI occurred when I was an undergrad working with a robotics professor, and we were trying to figure out new ways of creating AI algorithms. So, when did your interest in AI and machine learning blossom?
Right. It was about also in my undergrad, right? I was trained as a computer scientist, and during my undergrad, I was always interested in how computers or computer science can address real world problems. And during my PhD study in computer science, I started working on machine learning algorithm to predict molecule properties by looking at their structures. So it's small molecules as drug candidates, and we wanted to develop machine learning algorithms to predict the properties by looking at the graphical molecular graphs of those molecules. At that point of time, I realized how important and how critical that we can develop AI tools or machine learning tools for problems in healthcare. And after that, I always had this idea in mind, like if we can develop AI tools for very critical healthcare problems to really save life and improve the healthcare outcomes. And after my PhD, I started my career as a tenure track assistant professor, and I started exploring different areas in the healthcare domain. And that's why I'm here. And nowadays, we're doing a lot on AI for drug design, AI for electronic medical record analysis, AI for predictive analysis for healthcare outcomes. So everything related to healthcare, but using AI and developing AI tools.
So you started with molecules and then you evolved into thinking about AI applications in healthcare. And this is obviously a domain that is relevant to everyone if you think about the impacts and the outcomes. And so when I think about the areas of improvement, I'd like to dig a little bit deeper on one of those applications. And you had mentioned a little bit about this generative AI model. And the one that I specifically want to talk about is the one that creates realistic 3D structures of small molecules to help identify promising drug candidates.
Right. So actually, that was a very interesting research journey for myself. So I always had this idea about drugs, like how AI machine learning can help with the drug development. And it was about 5 or 6 years ago in the AI research areas, there were very nice, very interesting algorithms to generate new things. Like people started generating new images using AI. And at that point of time, I asked myself, yeah, that's a very interesting idea. Like AI goes beyond just prediction. Now it generates things. But can I live without the images generated by AI? So I asked myself that question, and my answer to myself is probably I can live without the generated images. But what can I live without if I apply generative AI tools on that area? And my answer to myself is probably health and everything related to health, like drugs. Then I got this idea, why not we generate new drug candidates instead of predicting existing molecules or predicting properties of existing molecules? So I think that at that point in time, I thought my idea was crazy because we are generating new molecules. But I asked myself other questions. Do I feel or is it possible to do that? And my answer to myself is it's probably possible because chemistry or drug development or small molecules, they are guided or they are governed by certain physical laws. And those physical laws do not change or do not change too much over time. So that means from the first principles, there should be ways or should be possible to use AI to reveal or to represent those physical laws. And given that, we should be able to design new things using AI based on those laws, physical laws. And also I ask myself, is there a huge amount of data to support my AI development? And the answer was yes, there are huge, and there are a lot of experimental data, molecule structures, all these data accumulated over years. It's a huge amount of data that can support AI development. As we know, AI really needs a lot of data, right? And also another question is, do I have the talents or do I have the good student to work on this very novel, crazy idea? And the answer to myself is yes, because we have great students from the computer science department. They are really, really well trained. So I was lucky enough to recruit good students to work on this new idea. And over the last 6 years, we have been developing a lot of AI tools, starting from AI drug small molecule structure design to molecule optimization, like we want to change the molecule structures a little bit to improve their property, also to synthesis planning. For example, we can always design whatever molecules we want in computers, but they may not necessarily exist in the nature. So we really want to make them into reality. So we we use AI to predict how to synthesize those molecules. And turns out our prediction or our synthesis planning algorithm is pretty accurate and blindly validated by a lot of collaborators and external companies. And very recently, we start using AI to develop agent to really do many different tasks in drug development automatically and in a very smart, efficient way. So I'm very excited about this area of research, and definitely demonstrate a interdisciplinary collaboration among many different expertise, many different domains, and also the training and education at College of Engineering for those PhD students, and how we join the force to develop something that is really highly impactful for healthcare. So that's my story about AI for drug development.
No, I love this story around how you walked from crazy idea, which you mentioned a couple of times, to transformative innovations. And I don't think a lot of people realize that when you are a scientist, when you're an engineer, that it does take creativity to create these types of breakthroughs. So thank you for sharing that story. You had mentioned earlier as well another project, initiative, innovation that you're working on. So I'm curious about your team's method of using machine learning and AI to summarize electronic health records to support healthcare professionals with clinical decision making. Tell us more.
Yeah, that's also another line of research that I'm very excited and passionate about. So the idea here is in the healthcare domain, there are a lot of data generated in the entire workflow, in the entire process, particularly a lot of electronic medical health records, right? It's a huge amount of data and very interesting type of data. Then the question becomes all the healthcare information is embedded there in the EHR data. then the physicians have to rely on EHR data in order to understand the patients, to understand the disease progress, to understand all the lab tests and make a lot of clinical decisions in order to make the best diagnosis, best treatment, and best outcome of the patients. As AI experts, machine learning experts, can we really help physicians to better utilize the EHR data, or can we really automate a lot of tedious routine processes on EHR data? So that's the overall motivation to improve the utility, improve the efficiency, improve the outcome of EHR utilization. So we have several lines, several projects along this line. The first one is about how to use AI to retrieve the most important information from EHR data for a particular patient. For example, if a patient comes into the emergency department with a chief complaint of, for example, shortness of breath or chest pain, that can be very life-threatening if it's related to heart attack, right? So in the emergency department, like clinicians are busy, so it's very important for them to make timely and accurate clinical decisions in order to process with the right treatment. So in this case, we developed AI tools to quickly identify the most relevant information to those chief complaints. For example, if it's a if it's a shortness of breath related to heart attack, then probably troponin or certain lab test results are going to be very informative compared to, for example, diagnosis of 10 years ago. And the informations can, the EHR identities or information can really prioritize and help physicians to make the next decision. So we developed information retrieval tools to really shorten the process for physicians to really manually look for such information, but our tools can automatically identify such information and make some recommendations. And another line of research is to predict the outcomes or the disease early onset using EHR data, and also to understand the different phenotypes among patients. For example, during COVID time, so we have, that was a very different time. And also we have the new disease, new infections, and we want to understand if we can predict the outcomes of patients with COVID, infected by COVID, and also want to understand how their phenotypes, like how different they are, and predict what kind of patient should have what kind of treatment. So we developed the algorithm to predict the outcome of COVID patients. For example, if they will survive easily, or they will have a hard time. And in that case, we want to understand their characteristics. For example, if they have a lot of existing conditions, or they have been taking certain medicines in order to give clinicians more ideas about their future treatment plan. So that's another example of using EHRs. But the overall idea here is we really want to leverage AI and develop better AI tools to help clinicians to better understand patients from their EHR data and make the best clinical decisions.
Oh, I always believe, especially in healthcare, that AI can ideally help us, assist us versus replace us. And so that was a perfect example to
Right.
navigate our audience through that. So a little bit another one that I heard, working with Dr. Douglas Scher at the Medical Center, you're developing predictive AI models to help physicians identify patients most at risk for developing Alzheimer's. Tell us more about that impact.
Sure. So Alzheimer's disease, it's more and more prevalent diseases nowadays for elderly patients, and even for patients with normal aging, we all care about whether it's going to be a healthy aging process, or if there are certain cognitive dysfunctions or certain diseases like Alzheimer's or Parkinson's that will significantly affect our quality of life. So that's why I was thinking about what would be the most impactful, or one of the most impactful diseases that AI can really help with. and it's one of the diseases came up as the Alzheimer's disease. So Dr. Shari is a physician at medical center here, and he develops a tool that actually it's an instrument or questionnaire such that if a patient or people answer those questions, there is a scoring system to access the functional, the cognitive functions of the subjects or of the patients. So I was thinking probably we can use AI tools to analyze that the answers and also the metadata generated from this question answering process. For example, how long that it takes for a certain person to answer a math question, and how well or if they can give the correct answer to a math question. I feel probably those are interesting markers that we can leverage to predict the cognitive the cognitive functions or to predict early onset of Alzheimer's disease. And at the same time, as I said before, there are a lot of electronic medical record data about patients, particularly for many senior patients, their EHR data is huge. The question becomes, can we also leverage the EHR data to predict if there is a development of function of cognitive impairment, or if there is a sign of early onset of Alzheimer's disease? So that's why that's really motivated me to work with Dr. Shari to come up with some interdisciplinary ideas and projects to do the early prediction of Alzheimer's disease onset. And I was really fortunate to receive this support from the President Research Excellence Award to initiate some preliminary work. And we published our first paper from the pilot study, and that really builds up the foundation for a very large grant that we recently received. So definitely this says the value of interdisciplinary work between AI expertise and domain expertise, and also demonstrate how AI can really make impact. So for Alzheimer's disease, a very interesting thing about Alzheimer's disease is it may starts to develop very early, but people don't realize that. Or many times, even people realize there might be some memory loss, but they don't want to admit that, right? And they don't want to go to the hospital. And for many people in the rural area, they do not have the access to such healthcare. For example, we have the memory loss clinics at OSU, but for people from rural area, they do not have access to these clinics. So we really want to build an easy to use AI tool such that people can use very easily. For example, we really want to build an app based on our research later, and such that people from just work from home or people from home can use the app and have a very quick and accurate access of assessment of their function, memory loss, or any issues with memory or with cognitive functions. So that really make the healthcare easily accessible through AI technologies. That's our actually ultimate goal of this project.
Which is a beautiful one. Imagine an app that is widely available that anyone could use. You've broken so much new ground in healthcare AI. So let me ask you, what most excites you about future applications beyond the app, which I think is an amazing thing?
Yes. So overall, I'm really excited about any AI applications or AI research that has been in silico, like in computers, but I really want to bring them in vivo or in situ, or in other words, bring AI into the physical world. For example, you have been working on robots a lot, right? That's definitely an example of in my work from in silico to in situ, because we embed AI into a physical thing, and that physical thing can really work in our daily life, right? In my case, I really want to make some real drugs out of our AI tools. So currently, we do have several molecules that have been designed by our AI tools, and they have been synthesized, and they are real molecules now, and they have been in the in vivo, in vitro tests at this stage. So my dream is to have at least one of them going through the clinical trials and hopefully become a final drug. That's going to be that really defines one of the successes in my career for sure. And also other tools in situ, meaning that I really want to have some tools developed and deployed at bedside. So they are really AI tools people can use or clinicians can use by the time they see patients. So it's about AI deployment in the healthcare system and also the widely accessible by many patients, by many physicians. That's going to be another big success for me if I can really have that in the next few years. So I'm really excited about these things. But overall, I think this is about how AI can really be accessible and make really impact on people's daily life, particularly related to healthcare.
So you are a fine example of how Ohio State has become a global leader in applying AI and machine learning to problems of consequence. I appreciate you being my guest today, and I especially appreciate that you're a Buckeye engineer.
Thank you for having me, and I really appreciate that the Buckeye environment and ecosystem really provide me all the tremendous opportunities to pursue research that cannot be easily done anywhere else.
Thanks for listening to Enginuity. Stay up to date on all the amazing innovation and groundbreaking research happening within The Ohio State University College of Engineering by connecting with us on LinkedIn, Facebook, Instagram, Threads, and X.